afternoon, doctor. We are from Group 6. I'm the leader of the group, Kib1010, metric number U2104524.
My name is Mia Irina Medina Srisham and my matrix number is U2102306.
I'm Lim Sin Wei. My matrix number is 22004447.
My name is Lamia Khan and my matric number is S2181549.
Our group will be presenting about magnetic resonance imaging, MRI. Below is a video of a model of MRI.
What is MRI? Magnetic resonance imaging is a non-invasive imaging technique that produces detailed anatomical images through the use of powerful, rapidly changing magnetic fields, computer, and radio waves. The key components of MRI machine are magnet gradient, radio wave, and computer. The history of MRI goes as follows. Sir Nicholas Tesla discovered the rotating magnetic fields in 1988. By the 1930s, Isaac Rabi developed a method to measure the magnetic properties of atoms, atomic nuclei, and molecules. In 1969, Damadian's research into sodium and potassium in living cells led him to his first experiments with nuclear magnetic resonance (NMR), previous name of MRI, which caused him to propose the first MRI body scanner. In 1977, Raymond Damadian, the inventor of the magnetic resonance scanning machine, performed the first full body scan of a human.
So for my part, I will explain about function and suitability of MRI. So the functions of MRI varies from scanning patients' brain and spinal cords, heart and blood vessels, bones and joints, breast and other internal organs and tissues, producing high-resolution image of the inside of the body that will help diagnose a variety of problems. So there are three main components of MRI machine. That is magnet, to produce strong magnetic fields, shim coils, to adjust the magnetic field to make it more uniform, and RF coils that act as antenna to transmit and receive signals from the tissue. How does MRI machine works? First, patients must stay still and not make any movement to prevent producing a blurred image of the scan. Next, MRI's powerful magnet will realign the proton of the body's hydrogen atom so that they all will spin along the same axis. When radio pulse is sent, atom will spin at a particular frequency and directions. The atom will then return to their own alignments and release energy, giving off signals, which then will be picked up by the computer to be processed and to produce image. Next is the suitability of MRI. One of the examples of an MRI is neuroimaging. It is used to examine whether there are any abnormalities in the brain, such as swelling, bleeding, tumors, infections, and any kinds of deformations of the brain. So based on the diagram, we can see the hemorrhage in brain and tumor in brain. So the next diagram is a comparison between a CT scan and MRI scan of the brain. So MRI is chosen over CT scans when it is related to cancer because the image of the posterior cranial fossa produced by MRI are clearer. MRI also produces contrast details of the grey matter and white matter. With this ability, it is able to study diseases related to the central nervous system such as epilepsy, dementia, and Alzheimer.
Next, I'll be presenting limitations in the treatment of disease that can be addressed. Magnetic resonance imaging, which is MRI scan, are highly accurate in detecting breast cancer and spinal trauma. They are frequently used in studying breast cancer and spinal trauma compared to other imaging tools like CT scan, ultrasound, and X-rays because they can't provide enough information. To detect breast cancer, a large cylindrical tube-shaped MRI scan creates a strong magnetic field. Magnetic field and radio waves change the naturally occurring hydrogen atom alignment in the breast. The activity of the hydrogen atoms is then used to create a two-dimensional image of one's breast using computers. Cross-sectional views can be acquired to explore more. According to Journal of Clinical Oncology, this study comprised 555 women who underwent 1,365 full imaging rounds. MRI had a sensitivity of 90%, which was significantly greater than mammography's and ultrasound's combined sensitivity rates. 90% of all breast cancers can be discovered via an MRI scan. Relatively speaking, the detection rate for mammography and ultrasound combined was only 37.5%. MRI scan can detect spinal trauma. Spinal trauma is when the spinal cord is irreversibly injured by external physical damage, which can leave the victim physically and neurologically disabled. MRI creates multiplanar pictures with remarkable anatomical and spatial resolution. It concentrates on the reaction of hydrogen nuclei, which are protons in cytosol, to an artificial magnetic field rather than requiring ionizing radiation. The magnetic field briefly realigns the proton, and the use of radio frequency pulses throws off its alignment. After the pulse is removed, proton returns to initial steady-state arrangement of it. Through the identification of variation during the protons moving, the MRI machine may distinguish between different tissues. Each tissue's signal strength is determined by the quantity of protons present, which is according to the tissue's natural water amount. Finally, by using different resonance, it is possible to visualize the position of structure of water, fat, bones, and other elements. In conclusion, according to BMC musculoskeletal disc, compared to the other imaging techniques, MRI has a higher accuracy in detecting spinal cord damage. MRI can be more beneficial since it can identify ligamentous injuries more accurately than a CT scan. Next, I'll pass to my teammate to explain more about the limitation of MRI. Thank you.
Now I will be presenting about the identifications of the limitation of MRI. The main limitation of MRI is the strong electromagnetic field, which will prevent patients with implant to undergo scanning in MRI, and also it will produce a loud tapping noise. The ion-based medical implants is prohibited in MRI scanning. There are a few examples of ion-based medical implants like the neurostimulator, cardiac pacemaker, artificial joint, the stent, eye implants, and also the cochlear implants. The large magnets are used in the MRI, and hence the magnetic field produced are 1000 times stronger than typical refrigerator magnets. The patients with implants enter the MRI scan will cause the object in the body to move, and they may malfunction and dislodge, which lead to internal or external injury, bleeding, and also fatal. Magnetic objects like key smartphones are not allowed as they can become projectile, causing damage to the machine and also injury to the medical staff and patients. So in this slide, you can see there are 4 examples of the incident happened in the MRI lab. Previously, I found news in PubMed stating that in 2009, an MRI pulled a metal oxygen tank across the room, smashing the 6-year-old child's head and causing a serious injury that resulted in death. Next is the loud tapping noise. The noise is produced when coils are subjected to electromagnetic current that are quickly oscillating. MRI noise levels are ranged between 65 and 130 dB, which means despite providing earphones, patients also will feel uncomfortable. A video of the sound produced by MRI will be shown in the next slide. In 2019, Shahid Renamun's hospital found that MRI can cause damage to the cochlear hair cell. Between 14 and 45 years old, 62 patients were selected, with the result that 29 patients were excluded because of mild or conductive hearing loss. The way to improve MRI is to implement a lower magnetic field in MRI. The right picture below shows the difference between conventional high EMF MRI and high performance of low EMF MRI. In 2019, Campbell stated that combining the lower EMF MRI with the progressive MRI acquisition hardware and software technologies of strong EMF MRI can improve the performance of MRI. As the picture below, the use of exogenous contrast agent like gadolinium-based contrast agent and improved diffusion imaging can produce better quality image. Also, the production of sound in MRI can be reduced by improving the receiver system. In conclusion, the improved low EMF MRI can enhance the performance of MRI by providing better image quality and maintaining patient comfort. Next, metamaterials is one of the materials that can improve the performance of MRI. From the diagram above, you can see it is composed of an array of 3 cm tall helical resonators, which is made of coil of thin copper wire and is constructed from 3D print plastic. By using this, the SNR of MRI can increase by the interaction of resonator with the magnetic field. The 2 diagrams show the high performance of imaging a tomato and chicken leg by using metamaterial MRI. So we can conclude that metamaterial MRI increases the imaging power improve image quality, decreases the scan time and associated costs, and maintain patients' comfort.
According to the U.S. Food and Drug Administration, an average CT procedure increases a person's risk of developing fetal cancer by around 1 in 2,000. With no use of ionic radiation in its mechanism, MRI has no issue of raising risk of cancer. MRI is preferred more as it can produce clear images of soft tissues than X-rays and CT scans, and it has fewer drawbacks. Furthermore, MRIs are considered safer for frequent imaging tests, which come in handy in cases for patients with chronic illnesses. The improvement of MRI has been made over the years, and it still can be improved to minimize the side effect on the patients, which is to implement the combination of a lower electromagnetic field with the advanced MRI acquisition hardware and software methods from a strong electromagnetic field.